Hi, there is an increased incidence of heart disease that we see today. We made aware of a lot of situations where youngsters get into problems, youngsters have heart attacks, and at the same time, the question is that a myth or is it a reality? Well, it's definitely not a myth, but at the same time, the reality is that we see an increased incidence because of a couple of reasons. One is that there is an increased awareness of heart disease. People are more and more health conscious in terms of trying to figure out whether they have any medical problems or not. And the second is that there is an increased incidence of what we call as coronary artery disease or atherosclerosis, basically because of our lifestyles. Our lifestyles have changed from what it was about 30 to 40 years ago to more sedentary, office-based lifestyles in a majority of patients. Access to facilities where people can exercise are very limited to the people who can afford to use it. So we have a situation where we have a lot of patients with no access to exercises and stuff, and we also have people who are under tremendous stress. Stress is a major factor in today's life. The problem is the stresses come under different circumstances. The question is, how do you deal with the stress? Dealing with stress is more important than the stressful situation itself. And how you deal with the stress, this reflects on what happens to your body. So people who can take stress and manage it well do not have a problem, and they do very well. At the same time, because of a relatively sedentary lifestyle and office-based practices, long commutes and dietary habits, I think we also are at a higher risk. Last thing that I would like to stress upon is that youngsters, especially those in the age group of 20 to 40, they work heavy, but they also party heavily. And that is where the problem comes in, lack of sleep. Lack of sleep is an important factor. And if you don't get an adequate 7 to 8 hours of sleep every day, then you are putting yourself at risk of developing heart disease. So be careful, eat healthy, sleep well, and exercise moderately. Anything in excess is bad. Even exercise in excess is bad.